Hello and welcome. It's an honor and a pleasure to have you here. I am Dr. Carla Menini-Stauschmidt. I am a doctor for 23 years, founder of Medicine and Symbolic and Vortex Method. And since you're here, you know that we're going to begin knowing how does this help you to understand what your body's been trying to tell you maybe for months, years, through symptoms, synchronicities, or even dreams, and you're not getting it. And as well, we're gonna have the part that will talk on how you can help other people, like your patients, for instance, with this method, and also bring this to the web in case you want to start a business online like I did 3 years ago. So, with no further taking times, we're gonna go to the explanation. So I hope you can see this here. Yes, you can. So I need you to understand that we have two different ways of living, and these two different ways of living are triggered by our brain and by the neurotransmitters that we have, which respond to stimuli, which can be exogenous from the outside or endogenous from the inside, and will activate one of these two paths. They are the path of fear or fighting, or fight or flight, let's say, is the other way we talk about this here, versus the way of, or the circuit of pleasure. Well, I call this in the symbolic medicine, it's the way of surviving versus the way of living. And what do I mean by that? I mean that depending on the frequency and intensity of stimuli of one side, one path, or the other, your body might respond with health or with symptoms and diseases, in fact. So this involves many other factors, of course, besides the environmental, the genetical, the heritage that you have in your family, the food that you put inside your body, how you feed your mind, and how you see the world. So all these things might affect the intensity and frequency of stimuli that you have in one of these two paths. And so, depending on this frequency and intensity, you will have a brain that will be more tendenced to go to the fight or flight way of living, which is adrenaline above all things, which in the end results in more cortisol circulating in your body, more inflammatory mediators, and in the last way, they go through the cells, different ones, different paths as well, and end up causing symptoms, not only inflammatory, but it starts like that. So when you see, if you have, like, for instance, woke up your whole life depending on the alarm clock, for instance, the first thing that happens in your day is the alarm clock set up and he goes off and you wake up like with the siren in your ear. And of course, that will make your heart beat faster. That will make adrenaline run through your veins. That will make your body understand it as there is a danger somewhere around and I need to be prepared. So if this happens occasionally, it will bring one kind of consequence to your body. But if it happens consistently, you might end up having some chronic issues, which will start with inflammation, and this inflammation will be directed to some organs and systems. And then you might ask me, okay, but how do I know which one and what are the preferences of which one? That's where the medicine and symbolic will get in, because there are certain archetypical or archetype patterns that will match with some symptoms patterns. And I will explain it to you in a few moments. And that's when you see that some behaviors, some emotional frameworks, some connective questions. What do you mean connective? I mean the environment that you're in, the family you're living, or the friends that you have, the relationship that you have might affect your body in that instance in the end of the day. So we will break this in 3 levels of investigation, which are called physical, mental, and connective floors of investigation, let's say like that. And when you understand this, you will see that depending on the symptom that you have or someone presents to you, you might have the beginning of that thread for investigation. Of course, you will do what in the first place? Always, I say this all the time. First thing you're going to do is always see the traditional allopathic way. You will find out if there's any anatomic issue, physiological issue on your patient or yourself or in anyone in your family. What does that mean? If the person has a problem with evacuation, for instance, right, the bowel dysfunction, and the person did not have this in the first place. Of course, the first thing you're going to look for is if there were any differences in the food habit of this person, or if you have any sign or symptom that are materialized as bleeding, as constipation, as mucus. And of course, you will do the regular investigation in the first place, which will include, for instance, colonoscopy or thermography. Once you find out in these exams that there are no issues of anatomical aspect or of physiological aspect, well, then you might go to the second level of investigation, which is what happens today in the vast majority of cases of, for example, bowel dysfunction in young women, which is the SSI, right? Or the inflammatory bowel syndrome, which is a dysfunction, not an anatomical issue. And this begins with these women having difficulties in liberate some emotional issues, some cultural issues as well. And then you go to the next level, which is the connective level of investigation. This is just an example. I'm just starting with you here so that you can understand. We'll find out these 3 levels of investigation, and we'll see how your body is talking to you and how dreams can come with some answers before it comes a symptom to you, and as well the synchronicities. So I'll see you soon.